Hi, my name is Dr. Sonal Kumar Jha. I'm a general laparoscopic surgeon. I work with Lee Crest Hospital, Vasundhara, Ghaziabad as a consultant. And today we are going to speak about Kegel exercise and its benefit, how it will benefit you to avoid many of the clinical conditions, including hemorrhoids. See, the pelvic floor muscle basically plays a role both in urination and while passing stool. It helps us to constrict while we pass the urine and relax the urinary bladder in the duration. And similarly, while passing the stool, it helps us to constrict the anal orifice and the adjoining muscles around it while passing the stool and even to hold it. So both pelvic muscles helps in both passage of the stool in a proper way and in passing urine. See, it provides the strengthening to the bowel habits and bladder habits like I mentioned earlier. So in the free flow of the urine properly and even in passing of the stool. So basically pelvic floor muscle has a goal strength for bladder and bowel habits in our body. If we have a proper strengthening of the pelvic floor muscle, it will avoid many of the conditions related to the colorectal problems and the urinary bladder problems. Any previous surgery, multiple comorbidities, patient is not physically ambulatory, like patient is bedridden. So these are the factors which may contribute in weakness of the pelvic floor muscles. See, in the Kegel exercise, basically what you do is you sit on a ball, which is theoretically said. You have to sit on a ball and you have to constrict. You have to constrict the way you defecate. You have to constrict your anal orifice. You have to do it for a while and then you have to relax it. Similarly, when you feel like to pass urine, you have to hold it before you pass it. Then again you hold it when you pass it. This will lead to the strengthening of your pelvic floor muscles. This is basically the Kegel exercise. Kegel exercise is best done in standing upright position or in sitting position on a ball. Medical conditions are related which can be helpful by doing Kegel exercise. Post-pregnancy patients who develop pelvic floor muscle weakness, they have stress incontinence. You must have noticed that many patients says that while laughing or while sneezing, they tend to pass few drops of urine, or they unintentionally they defecate a few drops of stool. So the pelvic floor muscle strengthening will enhance it in a proper way and will affect and help in not occurring these kind of symptoms. So fecal incontinence, stress incontinence of the urine, this are basically taken care by the pelvic floor muscles if a strengthening is done properly. Kegel exercise should be done by all the people who is having frequent constipation issues or urinary problem like benign prostate hyperplasia or prostatomegaly, and in patients who have just overcome surgery and they are into the recovery phase. So to strengthening of their pelvic floor muscle, they should perform the Kegel exercise, obviously in a proper way and by a proper guidance. See, like I explained you, it is best being done in standing upright or sitting on the ball. So if you are able to constrict your anal orifice, you will be able to feel that you are able to hold stool when you are wanting to pass it, but you can hold it and then you can relax it and then you can pass it. Similarly goes for passing of the urine. When you get the urge to pass the urine, go to the washroom, constrict it properly. Like I said, you're in the upright position, you have to constrict your orifices and then you will be able to hold the urination. Then you pass it again and again if you're able to hold it properly, this signifies that you're doing it in a proper manner. But likely I said you, it should be done only after proper guidance or training is being done. It won't be effective, it won't solve your purpose. It won't help for the condition you want to perform this exercise for. See, the pelvic floor muscle will not be strengthening. Though you're performing the exercise incorrectly, it won't help you. It's slow, it's a continuous process, but definitely in a couple of weeks, 3 weeks, you tend to see the improvement in yourself.